As we're still a new MSSP ACO, we are still recruiting practices and working through the requirements and setting up our processes. We're expecting it to be a tough sell to ask our providers for all of their patient data to fulfill the all-patient, all-payer quality reporting requirements. Do you have any advice for us?
Gwen, I feel your pain. But it's likely, I think, that you won't have as big a problem as you expect. Whatever outrage there's been, I've seen directed more at Medicare, not at the health organizations trying to meet Medicare's requirements. This issue first arose in 2017 when three-quarters of providers shifted from PQRS to MIPS. For most of MIPS, all patient, all payer quality reporting has been mandatory since the beginning. I was expecting a big outcry, but it seemed to be no more than a whimper as CMS asserted its rights to get what it wanted. Critics have been somewhat mollified by the observation that Medicare rarely sees the patient-specific data for non-Medicare patients. It only happens in the compliance and audit process. Now, you can kick the can further down the road if you want. You have only a 70% data completeness criteria. You can create a compliance submission without collecting data from the top 30% of your most aggressive objectors. But that creates a double standard in your ACO in which up to 30% of your providers are contributing less than the rest. And the reprieve is only temporary. Medicare will gradually increase the data completeness requirement. You can also use the web interface technique for 2023 and 2024 performance years. That restricts your reporting requirement to Medicare patients attributed to your ACO, but you won't be improving your data flow to help assure accurate measurement of high performance by the 2025 performance year, for which you must deliver all patient, all payer performance metrics that fully meet the quality performance standard. If you don't, you won't collect your share of savings. I recommend a straightforward and factual introduction of the quality reporting requirements to your participants. You have no choice in the matter, and your ACO can't function. It won't collect its shared savings if it doesn't comply with Medicare's all-patient, all-payer reporting requirements. If you need a reference, do an internet search on 42 CFR, that stands for Code of Federal Regulations, 414.1340. That will give you the schedule of data completeness criteria as far as it's laid out in the rules. There are two roles that we at Mingle can play in this. Often a big part of the objection is sharing deep, intimate performance data with local peers that may be partners in the ACO venture, but competitors in other business lines. We serve as an disinterested third party who can collect and process the data, giving organizational access only to the aggregate data, but not to the intimate details. We can also help communicate, as experts in the Medicare rules, the facts of the requirements and options. Good luck, Gwen. Again, I don't think it's going to be as big a problem as you anticipate.